Across Tasmania, this is Tas News 24 with Kane Dello.
Has made the media this morning. I spoke to Brendan Murphy a short while ago. To be frank, Brendan was commenting on a rumour. At this stage, our contact tracing has not identified a dinner party of health workers. However, I accept that this is a serious allegation and it's something that needs to be followed up. And so we will retrace our steps, but importantly, I've asked the Tasmania Police investigate this matter, and that will be started today. We need to get on top of this. We need to understand whether or not there is any strength to the rumour, because at the end of the day, I am certain that there are many hard-working health professionals on the northwest coast that feel that their reputations are being maligned, people that have done the right thing, and we need to understand exactly what's occurred here. But I do want to make this point. Regardless of whether or not that party took place, it does not change the fact that we need to get on top of this outbreak.
Hello and welcome to this special edition of Tas News 24. And you just heard from the Premier of Tasmania, Peter Gutwein there, addressing the media this morning in relation to a rumour that was in circulation about an illegal dinner party held in the northwest area of Tasmania. It all unfolded when Professor Brendan Murphy, who of course is the Chief Medical Officer for the Australian Government, made mention in a statement that a cluster of 49 cases of COVID-19 that was found in a hospital may have appeared due to a number of medical officers attending an illegal dinner party. Now it's been alleged that a number of doctors and nurses attended a get-together that may have involved people engaging in sexual acts. A person who wishes to remain anonymous said there were sexual interactions and indeed sex acts at the party, but safe sex did occur and a number of people were kissing and touching each other, which would potentially then transmit the virus should anyone be infected. It's alarming that Professor Brendan Murphy told the nation of this alleged dinner party taking place in Tasmania, but our very own Premier and Health Minister failed to notify the residents of Tasmania of these actions that had taken place. Questions are now being asked, had the Tasmanian government investigated these rumours a number of weeks ago when the alleged actions took place, would 5,000 people need to be placed into quarantine today? Again, it only causes further disadvantages that our Liberal government are failing the people of Tasmania time and time again. Reports of new people testing positive to COVID-19 within Tasmania are being told to the public late in the evening, again in time with the ABC News broadcast and printout times for local newspapers, when our government should be in line to the rest of Australia when it comes to reporting the facts and cases of COVID-19. It seems the Liberal government will go to great lengths to keep information, critical information, from the public. People of Tasmania have had enough and are calling on the Premier to be more transparent when it comes to delivering news on COVID-19. The Premier has tried to smooth over the rumours of the illegal dinner party and has stated Tasmania Police would be investigating the allegations. This all comes at a very difficult time for both the Premier and the Health Minister, Sarah Courtenay, as they try to control the outbreak of COVID-19 within the northwest region. The Health Minister said earlier in a press conference that a specialist team will enter the Northwest Regional Hospital and also the Northwest Private Hospital to start a deep clean in order to eradicate any traces of COVID-19 and to make sure both hospitals are able to be put back in operational duties as quickly as possible and to provide safe care for the community. The Minister went on to say that 17 cleaners are currently at the hospitals, cleaning the emergency department under the Infections Control Management Guidelines. However, that provides little comfort to many, as Tas News 24 can confirm. We received an email from a Tasmanian Health Service spokesperson, who is also a medical practitioner, who advised us that a team of doctors and orderlies have been pulled from their normal practicing areas to commence this deep clean. The doctor, who wishes to remain anonymous, has told us that this behaviour ordered by the government is concerning, as the doctors are being pulled away from caring for their patients to clean these hospitals, which in turn would mean once the clean is completed, all those doctors and indeed orderlies will need to enter into a 14-day strict quarantine. We have also been advised the deep clean must be completed within a deadline of 48 hours, hardly ample time to make sure both hospitals are safe for people to re-enter. It's also concerning that the government should have implemented a specialised cleaning team that handles infections and disease control to handle this massive task and not pull medical and hospital staff out of their already demanding roles only to be without them for a further 14 days, as they will have to be placed into quarantine after the cleaning is done. It seems the government continues to push aside critical advice provided to them from medical practitioners who are living and working within that region. The Premier stated in a press conference not to listen to social media and rumours, but it's hardly rumours when the information being told is true and comes from people working on the front line who are fed up with the government's deny tactics and continuing to keep crucial information hidden from the public, especially when it comes to what is happening in the state when it involves serious matters relating to COVID-19. We will continue to investigate these matters, and no doubt the government will play down our story. But before we go, please keep in mind everyone who is working on the front line trying to battle this ongoing issue of COVID-19 that continues to infect our state. We say thank you. This includes cleaners, orderlies, doctors, nurses, ambulance officers, patient care staff, social workers and emergency service workers who have been pushed to their limits and have gone above and beyond in their job title. This has been a very difficult time, and without their support, things would have been a lot different. So thank you to each and every one of you for all that you have done and continue to do. We will continue to cover this story and provide you with the honest coverage, the stories that you, the people of Tasmania, want discussed. Until next time, take care of yourself and others. Bye for now.